Now, the coronavirus pandemic has soared to more than 26 million cases in the United States, as new studies show that younger folks are largely responsible for the spread. We're joined now by Dr. Shad Marvasti, Director of Public Health Prevention and Health Promotion at the University of Arizona College of Medicine in Phoenix. Doctor, great to have you back with us. So we're seeing that younger folks and some middle-aged folks are responsible for about 3/4 of the transmissions in the United States. I'm wondering if that's just because, the age ranges of about 25 to 49 are some of the most, mobile in general, or if it's frankly that younger people are kind of selfish and feel invincible and are hanging out too much.
Yeah, thanks, Kristin. I think there's a combination of those factors that you just mentioned. As you know, that age range is definitely more mobile. They're out in the workforce, so they're out and about much more. And then also, they may have a false sense of security and safety, feeling more invincible as if they're going to be okay, they're going to tough it out. The problem is, that we're seeing that age group being the main source of new cases. We're also seeing over 80% of the deaths coming from folks over the age of 65. So really, it's a matter of conscious awareness of, the impact that your behavior has not only on yourself, but on others. And when you add to that the fact that the more the virus spreads, the more it mutates, creating new variants, getting out there and just saying, well, I'll probably survive it, I'll be okay, isn't a good idea because you're contributing to those new variants, some of which could be much more contagious, others that could be more deadly, and then still others that could be all of those plus escape immunity from the vaccines.
Now, despite the fact that we are seeing these really high transmission rates amongst these age groups, I'm wondering if you think that we've still managed to somehow turn a corner as we see hospitalizations continuing to come down, case counts continuing to come down. Do you think that we are, successfully winning in this fight, so to speak?
That's one of the things that we always have to kind of check ourselves. It's really a marathon. It's not just a small battle here and there. So we have to really think about the big picture with variants on the horizon. The reason why we're seeing a decrease right now is most likely because we're off of the holiday surge that we saw with the extensive amount of travel and gatherings that people did during the holidays. Now, that could change if a new variant that, as I mentioned, could be more contagious or more deadly takes hold or escapes the vaccines in terms of it being an escape variant. Also, if people have super spreader events or activities, again, things can kind of change very quickly with this virus. So we can't get ahead of ourselves, and we still have much higher hospitalizations, even where we are right now, than we did at the peak in the summer. So we're definitely not out of the woods yet, and people really need to be cautious and continue those mitigation measures because we still have a ways to go.
What's the best way, in your estimation, to get the maximum number of people vaccinated, since that's crucial as a part of this? Dr. Fauci says that you don't need to hold back the second dose. Wondering what your thoughts are on the best processes.
Well, we have to recognize that there's different vaccine platforms out there. So the two mRNA vaccines, the Pfizer and the Moderna, those are pretty, tied to those time frames, either 21 or 28 days. So you can, as Dr. Fauci said, you can be a few days off, maybe a week off, but there's not really data to support extending the time between the first and second dose. Now, when it comes to the Johnson and Johnson and the Oxford AstraZeneca, which there was some data that was released there with the Oxford AstraZeneca, those are different vaccine platforms where they're actually using viral vectors, actually using other cold viruses, one from a chimpanzee and one from humans, that are deactivated. And in fact, one of those, the Johnson & Johnson, only requires one dose. So in the case of the AstraZeneca, you may have the opportunity, as the data showed, to wait a few months, but that doesn't mean that's the same for all vaccines, especially not for the Moderna and Pfizer. So it really depends. And I think that's why it's important to take that nuanced approach, realizing that for the Pfizer and the Moderna vaccines, you really can't afford to wait too long for the second dose, but you may be able to have that opportunity for the other vaccines that are coming out because of the way they work.
Right. Dr. Shad Marvasti from the University of Arizona College of Medicine in Phoenix. Thanks so much for joining us again and bringing us all of those updates.